Well, happy windy Friday, everyone, and welcome to today's edition of Fun Fridays from the Field Middle School Career Chats, brought to you by NICC's College and Career Connection Program, a member of the Iowa Intermediary Network. Today, we're going to be discussing careers in the dentistry field. Thank you to Keystone AEA for being a partner in the creation of our career chats. And now on to our special guest today, Connie, and our moderator, Gina.
Thank you, Stephanie. I'm going to go ahead and just have Connie introduce herself and tell us what we're going to learn about today. What career?
Well, my name is Connie Behnken, and I am the practice manager of Dental Associates of Manchester here in Manchester, Iowa. I've been with the practice just shy of 35 years. I am a dental assistant, and I went back to school and got my business degree in 2003 and became the practice manager here when we combined our practices in 2002. I'm going to take you on a tour of the clinical area of our office. I'm going to have to do it on a side where there's no patients because I can't break HIPAA laws. But I'll give you an idea of what a treatment room looks like, some of the things that we do in our office, and then open it up for Q&A. Does that sound okay?
Yeah, and after you do the tour, Connie, if anything that you haven't covered on our worksheet, we'll make sure to get those questions addressed. But classrooms, if you have questions, please put them in the chat. If you're seeing anything and you're like, what is that? I need to know more about that. Put it in the chat and we'll be sure to ask Connie about that as she takes us on our adventure in the dental office.
All right, I got a new phone here, so I'm still learning how to switch the time around or the picture around here. Here we go. All right, so I am in the clinical area of our practice here. And as you can see, we have a long hall here. Our office has 7 hygienists, 7 dental assistants, and then I have 7 administrative people who take care of answering the phones, doing billing, and marketing and submitting insurance and so forth. So when you get into a clinical room, we see we have the patient's chair, and everything's computerized in our office. So we have a screen up so the patients can look at, or our doctors can look at x-rays. It has everything about the patient's chart. We write all of our chart notes through the computer now. This is a typical setup here for a restorative procedure. We have x-rays that we take in the rooms. Behind this here is our x-ray head. So our team members have to take x-rays of patients periodically. They're all digital. We do not have like the films anymore, so there's less radiation to our patients. Another thing that we feel very proud of in our office, and I'm hoping I can find where they put it, is we do use lasers in our office as well for procedures, which are very convenient. And for some situations, it eliminates the reason to even use anesthetic. We don't have to give people sleeping water is what we call it for doing treatment because it actually numbs the tooth. Our office does a lot of things. We do root canals, we do crown and bridge, we do straight wire orthodontics as well as Invisalign. We do implants and we do oral surgery. So just about everything that you want to have done can be done there. The other thing that we do now also, this is one of our little units, it's a scanner. So if people have ever had to have mouth guards made for any of your athletic events that you participate in, don't have to put that wonderful tasting mashed potato stuff in your mouth on a tray anymore. We actually have a little scanner that goes in and you put it around your teeth and it takes care of it that way. So another nice technological improvement to make that better. This is our oral surgery suite. If you need to have your wisdom teeth removed, we do all that. One of our doctors here actually has gone on and he has his conscious sedation certificate. So that means like if you want to be asleep or halfway awake for your sedation, you get a little IV. We can do that here as well. With that office also, we have a dental lab where we put all of our, make all of our impressions or pour up study models or any of our crown and bridge stuff that comes back from the labs gets put in here. And last but not least, I'm going to take you through our sterilization area. And this is one of our hygienists, Jennifer. This is where we make sure all the instruments are safe for our patients to be used. After they get used, they get cleaned and sterilized according to CDC and OSHA guidelines. We have to send stuff into the state every week, of stuff that was monitored daily, just to make sure that all of our equipment is working and keeping our patients safe. I'm going to now turn this back to me, and we'll go back to, that's just a little tour of the office. I don't know if I went too fast. If I did, I apologize, but we'll go back to my office and we can open it up for any kind of questions that you might have.
Well, I think we saw some areas of a dental office probably we've not experienced before. So thank you for that, Connie.
Yeah,
the first question I want to start with is, there's so many different areas and you mentioned different careers. Can you talk about all the different positions it takes to make your office run?
There's a lot of them. And I think a lot of people just think it's just the dentist, and that's so untrue. The dentist is a very important integral part of our practice, but we have our dental hygienists that take care of our hygiene program. So they basically are the ones that you would come to see for your routine checkups, be it, annually or biannually. And we have some patients with periodontal disease who are seen 3 or 4 times a year. We also have the dental assistant. She is the dentist's right-hand person that is there to assist with every procedure that goes on, seats the patient, helps with the treatment notes, does the impressions, whatever the doctor tells them to do, they kind of follow up. There's things that assistants are allowed to do under the supervision of a dentist. So the dentist can leave the room to go do a hygiene check, and the patient can still be having things taken care of and treatment can continue. So it makes us more efficient. There's also the administrative people. And a lot of people forget about that. We also have, we have to send out billing after the treatment's done. We have to send claims to the insurance company. We have to make the scheduling of the appointments, and then just the things that we have to do to send into reports that have to go for state and federal reasons for taxes and stuff like that. And then there's also IT. I take care of the IT as a practice manager, taking care of the computer network and making sure all the stuff works collaboratively together between all the computer things that we have in the dental clinical area anymore, like the x-rays and everything. So that information is cross-communicated and HIPAA compliant, so we take care of that. And then we have a marketing person who helps make sure that all the good things going on in our practice is put out to the public, and they know that this is a great place to come and see. We have great dentists and great team. And then our insurance specialist who also manages our membership program. We have some in-office things that we do. So there's lots of different things.
There is certainly a variety, and I'm sure a lot of things none of us considered that happen within a dental practice like that. So can you kind of just give us an overview of what kind of education is needed for those different positions? Like what would be a starting kind of area you could do with maybe not quite so much years of college or education, clear up to, I'm sure your dentists, right, have the most education. So can you give us a little bit of background on that?
Sure, absolutely. So like the dental assistants, that is about a 13-month course. I believe NICC actually offers it. We usually have students who are coming through here every year who do a rotation. And there's, I believe, NICC and Hawkeye and Kirkwood offer those. And it's about a 12-month program. And then the hygienist, that one is a little bit more. It used to be at the University of Iowa, and I think they might be even talking about bringing it back, but it was a 4-year program. And, but they have, that is offered at Hawkeye and DMAC, I believe, in Kirkwood. And they have, you do about 2 years of your prereqs, and then it's 2 years of actual hygiene. So you're looking at 4 years. And a lot of times my assistants who are thinking of being a hygienist, or people who are thinking of being a hygienist, I tell them, go be an assistant, because you're going to be a much more well-rounded, and you're going to have a step up on those people who are going into hygiene, because you already have a background in the dental field, and it's going to help you in that process. But about 4 years total for hygiene. Doctors, you're talking 4 years, just their undergrad, another year or two of, dental school, and as much as 4 years, if depending on if they're going into a specialty. Admin, you could possibly come into it right out of high school, if you have the right skill set. It's helpful to have a dental background, but we can train people a lot of those things. So if you have all the right skill sets, and you could possibly just walk into the admin portion of it.
So speaking of skill sets, in general, what kind of employability skills would someone need to be going into the dental field?
Well, there's some of them that apply to all fields or all jobs, and that's reliability. That is being a leader, a problem solver, and good with your time management. But attention to detail is a big thing in the medical field. I would say and being problem solving, because we are a lot of times patients coming into the office, they're coming in with symptoms, and you have to be able to decide what's creating those symptoms. And sometimes it's multifaceted, and can be a multitude of things, but pinpointing it to what it is. So attention to detail as well, because it's a medical field. You have to know about how medications interact with different things. When you're writing down chart notes and everything, I always tell everybody here, if it's not in the chart, it didn't happen. So that's very important. So also diplomacy, working in a team environment, or being a big picture thinker, because you have a role in the office, but you have to think about how your role interacts with everybody's roles in the office, so everything works, very well together. And self-discipline, I would say. Those are probably the biggest skill sets. I mean, there's other things as well, being a very good communicator, and being able to explain things very well to patients as well, and your team members.
Okay, we have a few more questions on our sheet, but I'm looking for good questions. This morning group always has great questions, so I'm looking to our students to throw some ideas out there. Do you want to just touch a little bit on the importance of confidentiality in the medical field, and also how the things you do now could impact your ability to get into that field in the future? I don't know if those are things that students always realize, and it's good to be planning ahead.
Yes. So the confidentiality is the HIPAA. What that basically means is that we cannot disclose anything about a patient when they're in our practice. That can't be shared. We can't share their picture. There's some things, if we have written consent. Without written consent, that's always how it is. But we don't want to compromise a patient by letting somebody know that something was done for them, because it's really nobody's business. How we send out billings have to be thought about, for envelopes, for statements and stuff. So that's why we're trying to get to ACH, or just electronic statements here soon, but that hasn't happened yet. But our envelope is very generic, so people don't know what is being done for them. Also, as regarding, our girls here in the office, we have access to everybody's addresses, their phone numbers, social security numbers, and all those other things. So we have to take steps to make sure that there's no identity theft. There's those things are encrypted. When we do send stuff outside of the office to a specialist, we have to go through encryption things so that we are protecting our patients' identities. and their information at all time. There's big fines if we breach that. I think it's like $20,000 per patient, per day, per whatever. They can multiply that up, or per incident, and they change that periodically. But yeah, it's very important that what's going on with the patient is it's about them, and nobody else needs to know it. If they want to disclose it, it's at their end, it's not at ours. And we do have like elderly patients and stuff like that we actually, or if you're 18, we start having you sign a form that if you want us to share your bill with your parents because they're paying the bill, they have to sign off that it's okay that we talk to their parents about what we're doing for them. So it's okay. And
so
things
questions
you do in your life, the things that you do in your life,
yes.
though, that can come back and haunt you, because it's going to be a trustworthy thing as far as going into a job to find out if you are of that reputation, because we want to make sure that the people who work here are of the highest caliber and reputable, to make sure that those standards are held up.
We have some great questions rolling in from our students. So tell us a little bit about starting pay, and is there a demand in the dental field for employees?
I am very fortunate right now that we aren't looking and we've got really long-term employees here, but I do know that there is becoming a shortage, and there will be more of a shortage for assistants and hygienists. I would say more assistants than hygienists, because hygienists do make more money than assistants do. I don't know that the difference is that huge. The one thing with being a hygienist is you're cleaning teeth all day. You're doing prophies, and you're doing patient education on hygiene. Assistants, you get to see everything that happens in the office. You get more variety, I guess is what I'm saying. But yeah, as our generation is retiring, there's not as many of you young people out there to replace us. And so there will be a higher demand. And I would say probably more for assistance and hygiene, but they're both going to be hurting for people. And dentists, I don't know about dentists. I haven't heard the latest on that recently. I know there's a bunch of them that are going to be retiring out very soon, but yeah, keeping people in the Midwest is probably the hardest thing. That everybody wants to go to a big city. Not very many people want to come to small communities, and that's unfortunate, because small communities have a lot to offer. Starting pay, dentists, depending on if they own their own practice compared to if they work for a conglomerate like Aspen or something like that. Our doctors are owners. You're looking at probably over $100,000 a month for doctors, and if they're a specialist, even more. Hygienists range right around, I'm just talking salary, I'm not talking benefits, but salary, if you were just the dollar amount for the salary, I would say somewhere around 60 to 80,000, depending on where you are for that. And then hygienists or assistants are somewhere right around, I would say, depending if they're just starting out, 32 to maybe 45, for assistants a year. But that doesn't include any benefit package you have with it, as far as vacation and stuff like that.
Right. And keeping in mind too, it's the fastest path to get into the field to start with that assistant position, correct?
Absolutely.
Yeah.
Absolutely. And the least college amount. I mean, it's very economical.
So I'm going to challenge our students to go out to the Future Ready Iowa website and do some research on their own on these positions and how in demand they are in Iowa, and research salaries. You can see all of that there. It's a great resource. So if you haven't checked that out, I would encourage you to do that. So here's a great question. Is this job gross sometimes, Connie?
Is it gross? Oh,
that's the question.
It can be. I've seen some gross things, yes. But we work in a very clean environment. Everything has to be sterilized and stuff like that. So we always have gloves on, we always have masks on. We're always, everything's sterilized and cleaned down and everything, but yeah, it can be. And you know, some people consider gross, some people consider cool. Like some people could never think about watching a tooth being removed. And I personally think it's kind of interesting. So, you know, it's a lot of people go out there and watch Dr. Pimple Popper. So, you know, I think that's gross too. So, you know, it kind of depends on what your level of gross is.
It's all in the perspective of the individual, right? So a great way to
Absolutely.
check that out is to do some work-based learning when you're in high school, get into that environment, maybe watch some online videos of those things happening and see how you react.
And the other thing is that if somebody is ever interested in going into the field, we do this a lot for students, high school and who are at the college. We let them come in and do job shadowing. They come to our office. We have somebody at least once a month that come in here and just walk around and follow an assistant or follow a hygienist or follow the doctor or admin. And just to get a feel of if they think this is what they would like to do.
Thank you for being a work-based learning partner, Connie. We really
You are
appreciate
welcome.
that. And we're at time, but I have 3 questions that I want to ask quick, and I hope nobody minds. We go a little bit over, but I think these are important. If a student is interested in going into the dental field, what classes should they take in high school? And tell us your top thing you love about your career and maybe one thing that you're like, ooh,
Okay.
I wish I didn't have to do that, but it's part of the job, so I do.
Okay. The best classes: biology, anatomy, chemistry, English writing skills, and foreign language is good because, you know, our community is becoming more diverse. So I think that is also a very good thing. But being able to not just interpret things or read things, but to write them. So English classes and any business classes are always an asset. So those would be the things. The thing that I love about my career is the difference that we make in people's lives. I've seen people walk in and they've got a terrible smile. They're afraid to look at the world and be who they are because they're ashamed of something. And we've had people walk out with tears in their eyes and the biggest smiles ever. And it's just heartwarming. And our office does a lot of outreach, and we do Veterans Day where we do free dentistry for all of our veterans. And that really brings us joy. The one thing that I don't like dealing with, it's insurance companies, because they take all the fun out of what we do. So that would be the only thing I can say. But no, I found this career to be very rewarding. I love the team members I work with, and I get to work with some of the most talented doctors in all of Iowa.
Well, thank you, Connie. This has been a fantastic session. Students, I hope you all enjoyed it and are starting to think about whether this is a great career field for you. So on behalf of Northeast Iowa College and Career Connection and the Iowa Intermediary Network, thank you for joining us.
Thank you.